Good morning, good morning, good morning. My name is Renee Hendon Bell. I will be your moderator for today for our discussion on prematurity awareness. We have Dr. Keaton on, and we're going to have a short discussion. She has her talking points, but before we get started, we always give honor to our five pearls, for without our five co-ed founders, we would not be here and pushing the extraordinary power of she. We give homage to our 26th International Grand Basilisk, Dr. Stacy N.C. Grant, as well as our 21st Southern Regional Director, Greta Washington McCoy, our 9th East Texas State Director, Dr. Tanisha Bernard, and our chapter president, Nikishi McGee.
Good morning. I would like to introduce Dr. Tochi Amagwala Keaton. Dr. Keaton is a dual board certified OBGYN and obesity medicine physician. Dr. Keaton is an alumna of Fairview A&M University and a graduate of University of Texas, Galveston branch, where she received her OBGYN degree before moving to Pine Bluff. Dr. Keaton started her practice in 2016. As a specialist for women, she has an expertise in treating fibroids, menopause symptoms, menstrual irregularities, sexual health, fertility management, and surgical management of women. Seeing a need in the community, she added an additional training and board certification in obesity management. Dr. Keaton is a proud physician owner of the HealthWise Direct PLLC, which is a direct specialty clinic located in Pine Bluff, Arkansas. The innovative membership-based clinic focuses on women's health, wealth management, and aesthetics, with the belief that healthcare should be individualized and focused on preventive medicine. Each member receives a personalized care and has direct access to the physician. Dr. Keaton's practices under the old African proverb that if you educate a woman, you educate a village. During her leisure time, Dr. Keaton enjoys traveling, history, and spending time with her boys and her husband. I'm proud to introduce Dr. Keaton, who's also my physician and also my cousin.
Thank you, Glenda, for that introduction. And it's a pleasure to be with you all today. Hopefully everybody can see and hear me okay. All right, so I am always honored to have the opportunity to speak about things related to women's health, particularly during this month where we focus on prematurity awareness. So definitely pleased to be with you all today. And I'll see if I can share my screen. Hopefully everyone can see it. Okay. All right. Can everybody see my screen? Thumbs up? All right, perfect. All right, so I'll get started. So I have just a few slides to share today, and then I want to open the floor for some questions. So I'm focusing on prematurity awareness today, understanding and preventing preterm birth. So the first thing that I want to go over is what is prematurity? So prematurity simply means any babies that are born before 37 weeks of gestation. So for us, completed gestation is 40 weeks, and we know that every week that a baby can stay in utero is significant for growth and maturity of the baby. We know that 1 in 10 babies are born preterm each year in the United States. Prematurity is also a leading cause of neonatal mortality and morbidity. So we know that presenting with awareness of this and the impact that it has can certainly help to improve some of those premature births. There are several causes of prematurity. We stratify these into the maternal causes, the fetal factors, placental factors, and uterine factors. Maternal factors are those that affect the mother. These include things that's maternal age. We know that moms that are younger than age 17 or older than age 35 tend to have a higher risk of prematurity. There are also health conditions that are associated with prematurity. These include things such as hypertension, obesity, and diabetes. There are also lifestyle factors that can affect prematurity. That includes things as smoking, drinking, and environmental exposure during and prior to pregnancy. Fetal factors include things such as multiple gestation, so a twin gestation or triplet gestation may have a higher risk of prematurity, and fetal anomalies, so developmental issues with the baby in utero. Placental factors include things such as placental insufficiency, which can compromise the nutrition of the baby, and things such as placental abruption, where a placenta may separate either because of any of these previous factors that I mentioned, or a one-time event that occurs that leads to bleeding in pregnancy. Uterine factors include things such as infections and structural abnormalities, such as abnormal placentation, where the placenta implants in an abnormal location. I do want to point out that with some of these factors, prematurity can occur spontaneously, but there are also times where we may intervene as obstetricians when we see that these factors are present and recommend early delivery to increase fetal and maternal outcomes. So there are some risks associated, as I mentioned, with prematurity, which is why we focus on preventing as many premature deliveries as we can. Short-term risks to the baby include respiratory distress syndrome and infections. Long-term complications include things such as developmental delays and chronic health issues. So you can see how preventing prematurity can help both with the short-term risk and the long-term risk. Short-term risk may mean that a baby may have to spend more time in the neonatal ICU or the NICU. Long-term complications can have several implications that can affect the lifetime of the baby into adulthood and also impact the family. So we are focused on prevention. At my clinic, I am always focused on preventative care. It's nice to know what the risk factors are, what things happen with pregnancy or prior to pregnancy, but seeing ways that we can prevent these risk factors empower my patients and also allow me to intervene to give them the best outcome. So many of us think that the things that happen with pregnancy are things that we manage during pregnancy, but I usually will talk to my patients who are of childbearing age about things that they can do to decrease their risk factors before they get pregnant. We know that many of the pregnancies in the United States are unplanned, so more than 50%. So finding ways that we can intervene before a patient conceives is one of the best tools that we have for preventing prematurity. So I do encourage patients that are of childbearing age to schedule what we call a preconception visit with their obstetrician to look at their risk factors and look at ways that they can manage those risk factors and optimize their health before pregnancy. So now when we get to prenatal care, we know that prenatal care and regular prenatal care and checkups can help to prevent some of those risk factors that I mentioned previously. And again, managing health conditions either prior to pregnancy or during pregnancy. Those can be things such as managing hypertension. If you're a patient who has been diagnosed with hypertension prior to pregnancy, optimizing your medication management, decreasing some of the risk factors associated with hypertension, such as obesity, may give you a better health outcome during pregnancy. And these are things that the patient and the physician communicate together to find a structured and personalized plan. Lifestyle changes can also help to improve some of the risk factors of prematurity. So avoiding smoking during pregnancy. If you are a smoker wanting to conceive, talking to your physician about some management that can help with quitting smoking, whether it's behavior modification or medication management. Also, alcohol use, we know, can be associated with risk factors of prematurity. So managing those things, and of course, avoiding drug use, illicit drug use during pregnancy. Medical interventions that we have once we've identified patients that are at risk for prematurity include things such as progesterone supplementation and cervical cerclage, which is a tool that we use for patients with incompetent cervix to improve their risk of going to a term delivery. So our role as OBGYNs is early detection, so identifying at-risk pregnancy and intervening early. So as I've mentioned previously, we prefer to do this prior to pregnancy, but certainly if you are pregnant, you want to establish early prenatal care with a physician who you can trust, who you feel comfortable communicating with, and who knows your health history. Patient education is also very important. This allows us to be able to inform our patients about the signs of preterm labor, the risk factors of prematurity, and of course, giving them information so that they can share with us when they notice any of those risk factors. Of course, I am in a room with women of influence, so I always want to empower you all to give you the tools that you can help the patients in your community that may benefit from this information. So there are things that you can do as mothers, aunties, mentors to women who may be at risk for prematurity. You can provide them with resources such as the March of Dimes, connecting them with obstetricians in the community who may be involved in community awareness programs such as this. And of course, supporting the family. We know that prematurity definitely has a financial implication, increasing the time that the mother and the father may miss from work. If you have a baby in the neonatal ICU, that takes a lot out of the family to visit the baby, just to kind of endure some of the things that may come along with having a baby who is born premature. So creating those support systems in the community is definitely important. So we as obstetricians try to help to link our patients with some of those resources that may benefit them. All right, so I will open up the floor to questions now. And thank you for your attention.
All right, Dr. Keaton. Seems we do have a question. One moment. All right, so the question is, what advice would you give families who have experienced premature birth to help them cope emotionally and mentally?
Yeah, so that's a great question. And I kind of highlighted some of that in my presentation. Certainly getting a good support group. For some patients, that may mean family members, but it could also mean linking up with people in the healthcare field who may be able to kind of explain the things that happen in detail, talk about some of the ways to prevent future preterm deliveries. We know that women who have had preterm deliveries have an increased risk of preterm delivery. So definitely looking at ways to prevent that may be ways to support those patients. Hopefully that answered that question.
Question. Okay. We have one more question.
Sure.
I had an incompetent cervix with my pregnancies. Would my daughters also have this issue?
That's a great question. So, cervical incompetence is something that tends to be spontaneous, but it can be associated with exposure prior to pregnancy. There are some chemical exposures that we know can change the anatomy of the vagina and the cervix, and they can lead to cervical incompetence. It depends on what the patient's risk factors were for cervical incompetence. Things such as what we call iatrogenic exposures. So for patients who may have had an abnormal pap smear, we may do a procedure called a LEAP procedure where we actually remove some of the cervix. Those patients we know are at risk for cervical incompetence because they physiologically have a shorter cervix that we've created. Some patients may have been exposed to certain medications in infancy or even in utero that may increase their risk of cervical incompetence. But most of the time, cervical incompetence happens spontaneously. So it's not really something that's genetic or passed along in those situations. However, if a patient is concerned about cervical incompetence, there are things that we can look at during pregnancy. We can do cervical link checks for patients who have an increased risk of cervical incompetence and identify some of those things early. And again, establishing early prenatal care is going to be your best bet for preventing that risk factor.
Right, we have one more question. Where are we now in reference to quality of care in Texas?
Oh gosh, that's a loaded question. How much time do you have? So I guess as far as the information that we have, the research, the data, we're doing pretty well as far as data is concerned. We know the things that affect women in pregnancy as far as risk factors for prematurity. We have some great tools for prevention. However, we're still lacking in things such as access to care and access to equitable care. Because there are some patients across Texas and really just in the rural South, particularly where I practice in Arkansas. There are patients who don't have access to quality care. We have a shortage of obstetricians. We have patients who live in the rural parts of both Texas and Arkansas who don't have an obstetrician for over an hour and a half. And you can imagine that someone who's in preterm labor or who has risk factors for preterm labor really can't afford to be 2 hours away from a high-risk area. And you have to have access to a neonatal ICU if you have a preterm delivery. Some of our rural hospitals are not equipped to handle babies that are less than 34 weeks. So you really need to have, there are a lot of things that we certainly can improve on in Texas and across the country in general as far as maternal care is concerned, and definitely with neonatal access to neonatal ICUs. So the short answer to that is we still have a lot of work to do.
Well, Dr. Keaton, on behalf of Gamma Omega Zeta chapter, we would like to thank you for this presentation. Thank you for this wealth of information and supporting our extraordinary power of S.H.E. So I want to say thank you.
My pleasure. Thank you for having me. And I do have my contact information here. If there are any questions that you did not get an opportunity to ask, you can certainly reach me by sending an email.
All right, thank you so much, Dr. Keaton. That ends our session, and we appreciate you. And feel free to log off when you can.
My pleasure. Thank you.
Thank you.